Hello, my name is Midwife Caroline and I am a member of the Birth and Beyond Parent Education team. In this video, we're going to be talking about ways that we can assess progress in labour and membrane sweeps. So there are many ways that your midwife or obstetrician can assess your progress in labour. We use things like your vocalisations, your discussions, your movement postures, even your breathing, as well as the pattern, strength and regularity of your surges and contractions. This is often called the Burville score, so we can do it formally by using a score or just part of our general observations. Sometimes we might need to do some physical examinations such as abdominal palpation where we feel your tummy or vaginal examination where we feel for the cervix. We'll always ask your consent for these procedures. With induction of labour, vaginal examinations play an important part in that process. We're not able to prescribe, administer or assess the effectiveness of our induction medications, procedures and devices without performing vaginal examinations. When we do perform vaginal examinations in early labour or at the end of pregnancy, we often use a score called the Bishop score. This helps us to assess more subtle changes, so things like how long the cervix is or how effaced it is, how thin, how soft, and the position of the cervix and the descent station of the baby, so how low the baby is in the pelvis. From this we'll get a score and we use this score to help determine which method of induction might be most appropriate for you. One of the first examinations that you might be offered at the end of pregnancy is called a membrane sweep. We usually offer membrane sweeps between 39 and 42 weeks of pregnancy, although you may be offered one earlier if you're being recommended to be induced earlier, so usually around a week prior to an induction date. The purpose or the benefits of the membrane sweep is that there's evidence to show that it helps reduce the chance of prolonged pregnancy, so reducing the need for more formal methods of induction like the ones discussed in our later videos. This can usually be performed as part of your routine antenatal appointment by your midwife or your obstetrician, so in your maternity hub, GP surgery or at the hospital. The midwife or obstetrician will always ask your consent before performing a membrane sweep. As we've already discussed in earlier videos, when making informed decisions, we need to balance the benefits and the risks. So I've discussed the benefits of sweeps, but it does come with some disadvantages as well. Some people find membrane sweeps uncomfortable. You can help yourself by focusing on your lovely deep breathing. So take a normal breath in through your nose and release it slowly out through your mouth. Other disadvantages of membrane sweeps is that there are some anecdotal evidence that suggests that you might have a longer latent phase should you go into labour as a direct result of that membrane sweep. There's also a chance of bleeding just due to the increased blood flow to the cervix at the end of pregnancy. Your midwife or obstetrician will monitor this, and if there are any concerns with the amount of bleeding, will advise you appropriately. If you experience bleeding later, please call the midwife advice line for support and advice. So a membrane sweep is performed as part of a vaginal examination. We'll usually ask you to recline in a comfortable position with your feet together and your knees apart. And then the midwife or doctor will insert 2 gloved fingers into the vagina and reach the back of the vagina to feel the cervix. They'll be assessing the Bishop score during that procedure. If the cervix is open, around 1 centimetre, so enough to admit a fingertip, the midwife or doctor will place a finger through the cervix and they use the tip of their finger to rub on the inside rim of the cervix or the inside edge of the uterus. The idea is that this will help to stimulate your natural prostaglandins, your natural softening and opening hormone, and hopefully encourage your cervix to start making those changes. If your cervix is not able to admit a finger, then the midwife or obstetrician will massage around the cervix for the same purpose, to stimulate those prostaglandins. You can have more than one sweep. We recommend waiting at least 48 hours between them, but the evidence shows that serial sweeps, more than one, are more effective at reducing the chance of you requiring an induction. You are welcome to decline a sweep or ask for it to be postponed to another appointment. And during the sweep, if you find that you are uncomfortable or you wish to stop, just tell your midwife or obstetrician to stop at any time. We recommend bringing or wearing a small panty liner or pad. Another small but important risk to consider is that we might accidentally release your waters. If this were to happen, we would have an individualised discussion with you about looking out for signs of infection and when it would be appropriate to induce or augment your labour. Watch the next video to learn more about softening the cervix and what to expect on St Catherine's ward.